Just to start with, can you maybe just tell us very briefly about yourself, who you are, and where you're studying and what you're studying?
I'm Jean Claude Nyirimanzi, a Rwandan medical student at the University of Global Health Equity, based in Rwanda. I was born and raised in East Rwanda and later on moved to Northern Rwanda for both my um, secondary studies and university studies. Um, I'm more interested in global health and public health, so that even though I don't have a very advanced background in that, but with my medical education, I do believe that I shouldn't only be in the consultation room. I think that global health is more interesting compared to just staying in one place and treat people. And that's where I see my future in my education. Thank you.
In terms of your essay, maybe just very briefly, can you tell us about the topic you chose, what your main argument or result was in your essay, and why that is an important message?
Thank you so much. So, when I was joining the competition, I saw many topics and they were all making sense to me and they were very important. But most importantly, I chose the one topic, the cost of distance when geography shapes health. And that's why I chose to write my essay. And my main argument in the essay was that geographic distance functions as a regressive structurally imposed cost on maternal health care access that does not appear on any health system, balance sheet, or anything in the system, but it is paid one in risk, second in lives, and it is paid disproportionately by the poorest and most remote women. And I ended my essay showing that health systems that can make care free at the point of use while ignoring the cost of reaching that point have not solved the access problem. It has actually solved only easier half of it. Yes, that was my main argument, and I think my argument makes sense to me and anyone who can read that essay because it reframes where the policy intervention needs to land. Um, it acknowledges that if distance is just a cost, it is an individual burden to navigate. But now it is a regressive kind of tax produced by structural decisions about facility distribution, road investment, and workforce deployment. Then it is a political and institutional failure, as I kept bringing it back in my essay, and that demands a political and institutional response.
Maybe before we conclude, before I ask the last question, can you maybe just tell us a little bit briefly about what the competition meant to you, why you entered, and what your experience has been?
When I saw the topic about distance, it resonated strongly with that lived experience, and I decided to join the competition as long as it was about writing, which is my favorite thing. And personally, through the process and with my educational journey, I've learned that when it comes to the health services, sometimes health options are limited. It's either that you afford it or not. And so the solution will lie in designing policies that um, acknowledge those ones who have constrained the agency, those ones who have limited the options, especially the ones from rural areas, the mothers who are so vulnerable to the consequences of the issues that are happening. Thank you.
Maybe just to give you the last word, what message do you have for other people that are considering entering the essay competition?
One message that I will give people who are considering to enter this competition, I would say This is not about, writing the entry and winning a very good money, which is good, but I think this competition is that platform that gets you to reflect on yourself and ask you what do you understand behind all the health economic concept, all the economic figures that you've seen so far. How do you connect it to the real life, and how does it translate to the people who are suffering more, and how can it benefit those ones who are at a very great risk?